So many people now during the holidays have been asking me questions about getting new teeth. They've asked me questions about all-on-4s. And of course, these are people with terminal dentitions or people that are denture wearers that want to get into implants. One of the biggest misconceptions is the difference between an all-on-4, which is minimum of 4 implants with fixed teeth on top of those implants, versus the type of prosthesis that kind of snaps in and snaps out. It's common to see the very, very bare minimum in implant dentistry being 2 implants on the lower jaw to be able to have a denture that snaps in and out. Now, what's the difference? With a snap in, snap out, for the most part, you get retention. That means that the denture stays in your mouth. It stays where it is. However, with an all-on-4, you get retention plus stability. That means that when you chew, the denture doesn't move. The teeth don't move at all. The level of confidence that you have with an all-on-4 is miles away from the level of confidence that you'll have with a snap-in, snap-out. Again, the difference is retention, which is it stays in your mouth, it stays over the jaw, versus stability, and that means that you don't perceive any movement. In the model, you'll basically see a typical all-on-4. Surgically, we place implants that are spread out throughout the jaw. And even when we have issues of sinuses and not enough bone in the back, well, that's one of the beauties of this protocol. We intentionally tip the posterior implants away from that anatomical restriction. We engage in really solid bone, but if you'll notice, our connection point to the teeth is still back here where it belongs. Okay? That's one of the things that we can accomplish with an all-on-4. With an overdenture, when we're just placing 2, well, we have no choice. If you connect the dots, it's a straight line, and that's a point of rotation. There's no counter forces that keep everything in place. So I hope that clears up a few of these questions that are coming up.